nomor 99 Jember. STIKES Dr. Soebandi Jember, langkah pasti menuju profesi apoteker, perawat, dan bidan. Pilihan terbaik bagi lulusan SMA yang ingin mendalami ilmu kesehatan. STIKES Dr. Soebandi Jember, kampus unggul Kopertis wilayah 7 Jawa Timur, terbukti lulusannya mampu bersaing di tingkat nasional. STIKES Dr. Soebandi Jember memiliki program studi S1 Kebidanan, Profesi Kebidanan, D3 Kebidanan, S1 Keperawatan, Profesi Keperawatan atau Nurse, S1 Farmasi, dan program studi D4 Analis. Dibimbing pengajar profesional, didukung program unggulan berbasis keperawatan dan medikal bedah, farmasi herbal, training by expert, kewirausahaan, juga penguasaan bahasa Arab dan bahasa Inggris. Menempati kampus megah dan representatif, fasilitas belajar lengkap, tersedia beasiswa, serta biaya pendidikan yang terjangkau dan dapat diangsur. Info lanjut hubungi 483536 atau langsung ke Jalan Dr. Soebandi nomor 99 Jember. STIKES Dr. Soebandi Jember, langkah pasti menuju profesi apoteker, perawat, dan bidan. Pilihan terbaik bagi lulusan SMA yang ingin mendalami ilmu kesehatan. STIKES Dr. Soebandi Jember, kampus unggul Kopertis wilayah 7 Jawa Timur, terbukti lulusannya mampu bersaing di tingkat nasional. STIKES Dr. Soebandi Jember memiliki program studi S1 Kebidanan, Profesi Kebidanan, D3 Kebidanan, S1 Keperawatan, Profesi Keperawatan atau Nurse, S1 Farmasi, dan program studi D4 Analis. Dibimbing pengajar profesional, didukung program unggulan berbasis keperawatan dan medikal bedah, farmasi herbal, training by expert, kewirausahaan, juga penguasaan bahasa Arab dan bahasa Inggris. Menempati kampus megah dan representatif, fasilitas belajar lengkap, tersedia beasiswa, serta biaya pendidikan yang terjangkau dan dapat diangsur. Info lanjut hubungi 483536 atau langsung ke Jalan Dr. Soebandi nomor 99 Jember. STIKES Dr. Soebandi Jember, langkah pasti menuju profesi apoteker, perawat, dan bidan. Pilihan terbaik bagi lulusan SMA yang ingin mendalami ilmu kesehatan. STIKES Dr. Soebandi Jember, kampus unggul Kopertis wilayah 7 Jawa Timur, terbukti lulusannya mampu bersaing di tingkat nasional. STIKES Dr. Soebandi Jember memiliki program studi S1 Kebidanan, Profesi Kebidanan, D3 Kebidanan, S1 Keperawatan, Profesi Keperawatan atau Nurse, S1 Farmasi, dan program studi D4 Analis. Dibimbing pengajar profesional, didukung program unggulan berbasis keperawatan dan medikal bedah, farmasi herbal, training by expert, kewirausahaan, juga penguasaan bahasa Arab dan bahasa Inggris. Menempati kampus megah dan representatif, fasilitas belajar lengkap, tersedia beasiswa, serta biaya pendidikan yang terjangkau dan dapat diangsur. Info lanjut hubungi 483536 atau langsung ke Jalan Dr. Soebandi nomor 99 Jember. STIKES Dr. Soebandi Jember, langkah pasti menuju profesi apoteker, perawat, dan bidan. Pilihan terbaik bagi lulusan SMA yang ingin mendalami ilmu kesehatan. STIKES Dr. Soebandi Jember, kampus unggul Kopertis wilayah 7 Jawa Timur, terbukti lulusannya mampu bersaing di tingkat nasional. STIKES Dr. Soebandi Jember memiliki program studi S1 Kebidanan, Profesi Kebidanan, D3 Kebidanan, S1 Keperawatan, Profesi Keperawatan atau Nurse, S1 Farmasi, dan program studi D4 Analis. Dibimbing pengajar profesional, didukung program unggulan berbasis keperawatan dan medikal bedah, farmasi herbal, training by expert, kewirausahaan, juga penguasaan bahasa Arab dan bahasa Inggris. Menempati kampus megah dan representatif, fasilitas belajar lengkap, tersedia beasiswa, serta biaya pendidikan yang terjangkau dan dapat diangsur. Info lanjut hubungi 483536 atau langsung ke Jalan Dr. Soebandi nomor 99 Jember. STIKES Dr. Soebandi Jember, langkah pasti menuju profesi apoteker, perawat, dan bidan.
Kalau pusingin tuh bisa 2 akun nggak ya? Coba ya, nggak bisa ya? Coba, di atas deh. Bentar. Maksudnya di bidang web. Bisa deh.
harapkan berhadapan menyaksikan Righteous Patrani berhadapan dengan Alvera. Dan seperti saya tidak akan pernah Anda menyaksikan ronde demi ronde yang berlangsung seru, yang berlangsung panas ini. Sudah ada dua analis. Yang pertama adalah mantan petinju kita, yaitu Bung Sikat Pasaribu. Apa Bung Sikat?
Selamat pagi Putri. Selamat pagi untuk kita semua. Horas Indonesia, horas tujuan kita tetap harus tetap semangat untuk meningkatkan ilmu kekuatan tubuh kita.
Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. His Excellency, Director of STIKES Dr. Soebandi Jember, Mr. Dr. Said Marjianto, Bachelor of Nurse, Master of Management. The Honorable Mr. Muhammad Farhan Hanif bin Redwan, Doctor Veterinary Medicine, Philosophy of Doctor, Coordinator Clinical Pathology Laboratory Senior Lecturer of Veterinary Medicine, University Malaysia, Kelantan. And Mr. Rian Anggia Destiawan, Bachelor of Veterinary Medicine, Master of Immunology, Secretary of Undergraduate Medical Laboratory Technologist, Program Lecturer of Medical Laboratory Technology STIKES Dr. Soebandi Jember, Indonesia, as speakers of third webinar series today. The Honorable Mr. Anas Fadli Wijaya, Bachelor of Applied Science, Master of Immunology, Head of Undergraduate Medical Laboratory Technologist, Program Lecturer of Medical Laboratory Technology STIKES Dr. Soebandi Jember, as moderator of third webinar series today, and respectable all participants of this webinar. Before this event starts, let us listen to the song Indonesia Raya. To those on duty, please. Next, we invite Mr. Dr. Said Marjianto, Bachelor of Nurse, Master of Management, as Director of STIKES Dr. Soebandi Jember, to give a speech as well as officially open the third webinar series Pathology and Immunology of Burn. For Mr. Dr. Said Marjianto, time and place is yours.
Okay, thank you. Good morning, everybody. Alhamdulillahirabbil alamin. Let's thanks to our God, Allah Subhanahu wa Ta'ala, who has given us healthy, and his blessing, so we can help in the third international webinar in STIKES Dr. Soebandi Jember this morning. On this opportunity, I would like to deliver my deep attention to the honorable and respectable. First, to Mr. Lulu Sasmito as Kepnas MKes, as the representative of Management Jember International School Foundation. Second, to our keynote speakers, Mr. Dr. Muhammad Farhan bin Ridwan, PhD, Mr. Rian Anggia Destiawan, Magister Imun, and to our lecturers and staff STIKES Dr. Soebandi Jember, especially Mr. Anas Fadli as Ketua Program Studi TLM STIKES Dr. Soebandi Jember. And the last one, the third webinar participations. On this opportunity, I would like to give my great appreciation to all the third webinar team on your work hard so we can help the international webinar in this morning. Dan tak lupa saya sampaikan welcome in the white camps to the keynote speaker on your coming. Thank you for your time and attention. Thank you so much. We are grateful and thanks to God, as always, give us a precious and valuable time, so we can always learn many things and always take the benefit of it. So, through this international webinar, I expect that all the third webinar participations could absorb and increase the information and knowledge concerning with the theme of the third webinar, that is pathology and immunology of burn wound. Ladies and gentlemen, I realize that the implementation of the third webinar program cannot be running well without the participation from all the academic activities, so that I am, as the institution, give full support and motivation in order to participate in the third webinar program. The last, I am as a chairman of STIKES Dr. Soebandi Jember, would like to say so sorry and thanks so much to all the team, especially to all the keynote speaker and the third webinar participations today on this your support. Okay, before I close my speech, I can to say selamat mengikuti seminar. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Thank you to Mr. Dr. Andesaid Margianto for this welcome. As we have finished our opening, to lead the next session, I would like to introduce Mr. Anas Fadli Wijaya, Bachelor of Applied Science, Master of Immunology, as moderator the webinar today. Here, I will read the CV of our moderator on this webinar today. Name, Anas Fadli Wijaya, Bachelor of Applied Science, Master of Immunology. Place or date of birth, Tanjung, 3 January 1994. Phone number +628 776 555 44 and 33. Email anasfw94@gmail.com. He is head after undergraduate medical laboratory technologist program in STIKES Dr. Soebandi Jember. He has received his bachelor degree in medical laboratory technologist at Politeknik Kesehatan Kemenkes Mataram and taken his master degree in immunology at Airlangga University. Without further ado, let's welcome our moderator, Mr. Anas Fadli Wijaya. Time and place is yours.
Thanks, Miss Dini. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Good morning, everyone.
Morning, sir.
Morning.
Respectable the Director of STIKES, Dr. Soebandi, Dr. Said Marjianto, Bachelor of Nurse, Master of Management, the Honorable All Lecturer of the Medical Laboratory Technologies to the program of STIKES, Dr. Soebandi, and the Honorable All Participants of this webinar. Ladies and gentlemen, I'm Anas Fadli Wijaya, the moderator of today's webinar. I'm very pleased to see you here and welcome all of you to this webinar. This webinar is about pathology and immunology of bone wound. Ladies and gentlemen, we have two speakers today. First is Dr. Muhammad Farhan Hanif bin Redwan, Doctor of Veterinary Medicine, Philosophy of Doctor, with the material Pathology of Bone Wound. The second is Mr. Rian Anggia Destiawan, Bachelor of Veterinary Medicine, Master of Immunology, with the material Immunology of Bone Wound. Before the presentation begins, let me inform how the presentation will be going on. First, Dr. Muhammad Farhan Hanif bin Redwan, Doctor of Veterinary Medicine, Philosophy of Doctor, will be invited to present the material. After that, Mr. Rian Anggia Destiawan, Bachelor of Veterinary Medicine, Master of Immunology, will be invited to present the material. After all the speakers have made a presentation, there will be question and answer session and followed by conclusion. All participants can ask questions via the link in the chat Zoom column. Okay, our first speaker today is Dr. Muhammad Farhan Hanif bin Redwan, Doctor of Veterinary Medicine, Philosophy of Doctor. I will read his CV. Okay, this is a CV of Dr. Muhammad Farhan. His number telephone is +60136081885. Email mohfarhanhanif90@gmail.com. He is head of Paraclinical Department, Senior Lecturer, Coordinator Clinical Pathology Laboratory, Faculty of Veterinary Medicine, University Malaysia Kelantan. Education. Sekolah Kebangsaan Jengka 19. Sekolah Menengah Kebangsaan Sri Jengka Maran Pahang. Pahang Matriculation College, Kuantan Pahang. Doctor of Veterinary Medicine in University Malaysia Kelantan on 2014. Doctor of Philosophy, University Putra Malaysia on 2018. Employment in Poultry Veterinary Penang, Malaysia, 2014. Young Lecturer, Faculty of Veterinary Medicine, University Malaysia Kelantan on 2015 until 2019. Senior Lecturer, Faculty of Veterinary Medicine, University Malaysia Kelantan on 2019. Administration experience, Head Department of Paraclinical Studies, Faculty of Veterinary Medicine, Clinical Pathology Laboratory Coordinator. Now, allow me to welcome the first speaker, Dr. Muhammad Farhan Hanif bin Redwan, Doctor of Veterinary Medicine, Philosophy of Doctor, to deliver his presentation. Dr. Muhammad Farhan Hanif bin Redwan, Doctor of Veterinary Medicine, Philosophy of Doctor. The time is yours.
Okay, Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi
Waalaikumsalam warahmatullahi
Very good
wabarakatuh.
morning to all lecturers and students of STIKES, Dr. Soebandi, especially to the head and chairman of the STIKES, Dr. Soebandi, Dr. Said Mardijanto, and then our moderator for the seminar today, Mr. Anas Fadli Wijaya, and another speaker, Mr. Rian Anggia Jestiawan. Okay. So can everyone see my slide?
Yes.
Okay. First and foremost, I would like to say thank you very much to the organizer of this third webinar, MLT STIKES Dr. Soebandi, for inviting me to share some information on the pathology of the burn wound based on the research, especially in animal model. And I would like to say I deeply appreciate the efforts made by the committee to invite me so that we can share the information with the students at STIKES Dr. Soebandi. So this is my profile. So I was born in the state of Pahang in the peninsula of Malaysia. And then as the moderator mentioned just now, I graduated Doctor of Veterinary Medicine from University Malaysia Kelantan in 2014 in Kelantan. And I think last time I met Mr. Rian Anggia Jestiawan in Kota Baru, Kelantan. And then since that we know we communicate each other and we have a good friendship. And I think in 2019 I visited Surabaya, Airlangga, and also I met with Anas and others. And I'm very happy to be invited for today. And currently, I work as a senior lecturer and head of the paraclinical department. And for your all information, the department of paraclinical department teach paraclinical subjects in veterinary medicine, such as bacteriology, virology, immunology, microbiology, pathology, clinical pathology, and etc. So my area of expertise is mostly in the veterinary clinical pathology. So I do some research area on the wound healing study, in the acute phase protein, in animal disease, and also I apply therapeutic and herbal medicine. So this is my content of my lecture today. I'm going to introduce about burn injury. Second, I will move on the definition of the burn wound, and then various types of the burn wound, on the damage of the burn wound, microscopically and also microscopically, and then how we're going to prepare a slide for the hematological, for the H&E staining and also immunohistochemistry staining, and the last one going to be an interpretation result of the burn wound examination. Okay, let us start with the burn injury. So I believe that everyone knows, you have idea what are burn injuries. And so burn injuries, we can say it is under a patient trauma. So it can affect anyone, anytime, and also anywhere. So there are many causes of the burn injury. It could be due to the friction, cold, heat, radiation, chemical, or electrical sources. And according to American Burn Association in 2009, they state that the majority of the burn injuries are caused by the hot liquids, solid or fire. And these different types and causes of the burn injury, it will causes a different physiological and also pathological response. Burn injuries, especially on the severe type of burn, it involved with the immune and inflammatory response, which is this topic will be covered in detail by Mr. Yan. So other than immune and inflammatory response, we can observe also metabolic changes after the burn injury and also a distributive shock. Okay, and this condition, it will lead to the multiple organ failures, and also it can cause die either to the human or animal. Okay, the slides to show you the conditions of the burn injuries in human. So there will be a blister present. You can see there will be a hyperemic or reddening of the hand, reddening of the fingers. We may observe also a black spot. And in severe cases, the burn will destroy the skin layers and it will expose the muscle. And one thing to remember also, burn injuries also occur in animals, in cats, in dogs. Especially right now, we see high cases of the veterinary forensic cases in animals due to the criminals. So some humans, they may cause a burn injury to the animals. And then now we move to the more detail on the causes of the burn injury. Like for example, a flame. A flame, it can cause an immediate deep burn, and the scalp injury, which is from hot liquid or from the steam, it will cause a superficial at the beginning, and then when we go to the laboratory, we might expose to the chemicals, alkaline chemicals, acidic chemicals, so it will cause a further necrosis of the skin. And then some kinds of burn injury due to the electrical supply, which is usually it can lead to the deep tissue damage, and also thermal injury, which also can occur through cold and also post-by. Okay, so now what is definition of the burn wound? So burn wound is type of wound due to thermal injury, either it caused by biological agent, chemical agent, electrical, and also physical agent, as we discussed just now. So what happens is when there is a burn injury, there will be a burn wound. So as we know that the normal function of the skin, one of the normal function of the skin for the thermoregulatory functions, the skin as a barrier from any infection, barrier from any bacteriological agents. So when there is a wound, so there will be a rupture of this cutaneous barrier. That's why we will see a further consequences. So what are these consequences? Number one, there will be a loss of the protein, loss of the body fluids. So when the wound is exposed, so there will be a contamination of bacteria. And this bacteria, it can cause a further infection. And the one thing to take note and remember that the infection itself is a major complications in case of burn wound. And studies have stated that 75% death following a burn injury are related to the infection. So when we talk about burn wound, burn injury, so we have to at the early we have to understand on the histology and anatomy of the skin. And basically the skin of human or even animals are made up of the 4 layers. The first one is an epidermis layer. There will be a dermis layer. There will be a subcutaneous tissue and also a muscle. So in this slide, I show you both I show you the histological finding of the human skin. So this is the human skin histologically, which is more detailed. We can find like other than epidermis, dermis, subcutaneous and muscles, there also a presence of a sweat gland, a sebaceous gland. There also erector pili muscles, presence of the hair follicles. Okay, now I move to the various type of the burn wound. Okay, as you guys know, burn wound can be classified, can be divided into 4 types, which is we call it a first degree wound, second degree wound, third degree wound, and also fourth degree wound. Okay, first one, we talk about first degree, which is superficial thickness, and this type of burn wound only involved with the epidermis layer. It will involve with the epidermis layer. So the skin will become red and we will feel a pain. Okay, in the first degree of wound, so the skin will appear red and we will feel pain. But in the first degree, it doesn't cause blister, it doesn't cause scar. Okay, and second degree of wound, they have 2 types. The first one is superficial partial thickness, and number 2 is a deep partial thickness. Okay, superficial partial thickness, it will cause a more painful, but it doesn't need the surgery. Okay, another one is a deep partial thickness. This one is less painful because of what? Because the nerve, the pain receptor is destroyed by the burn. That's why in case of deep partial thickness, there will be a less painful. But both second degree of wound, there will be presence of blister and whip. And with increasing depth of the wound, there will be an increased risk of infections. There will be increase of the scarring. Okay, the third one, we call it as a full thickness. Full thickness mean what? Full thickness mean the wound itself, it covers, it destroys the epidermis layer, it involves with the epidermis layer, the dermis, and also the dermis layer. And this third degree of wound, usually there's no pain. Because of what? Because the pain receptor is already removed, or the pain receptor is lost due to the burn injury. Okay, the last one, which is the severe type of the burn wound, we call it as a fourth degree of wound. It will involve with all the layers, including the muscle and also bone, muscle and bone. And this one usually lead to the loss of the bone part. Okay, this is the summary of the different degree of the burn wound, and according to the American Burn Association also, they classify the burn into 3 types: minor, moderate, and also major. Okay, how they decide minor, moderate, and major? So they decide based on the TBSA, which is the total body surface area. Okay, like for example, major type of burn in the second degree of wound, it involves 25% of the total body surface area. That means 25% of body is affected. But in case of children, because children is smaller in size, so if more than 20% of the area is affected, so we can classify, or we can call it as a major burn.
Kita harus memahami bagaimana inflamasi yang terjadi di otak dan sistem vaskuler. Mengenai proses sederhana, bagaimana restorasinya, bagaimana neuroanatomi dan teritori vaskuler, bagaimana fungsi dia dan neuron, bagaimana mekanisme kematian transfusinya.
Okay, saya continue ya. Okay, zone of burn injury. So they have three zones. The first zone, we call it as a zone of coagulation, and which is in this zone of coagulation, you will observe a cellular death, and most damage is occur in the zone of coagulations. And number two, there will be at the middle area, we call it a zone of stasis. So this zone area, there will be a compromised supply of the blood, inflammation, and also tissue injury. And the last zone, which is the outer zone, we call it as a zone of hyperemia. There will be a least or less damage in this area. Okay, I show you the area of the zone of stasis, zone of coagulations, and also zones of the inflammations. Okay, at the center, there is a zone of coagulation. And in this zone coagulation, so this is a severe damage part. So there will be a necrosis in these zones of coagulations. And for the zone stasis, there will be a compromise of the blood supply. There will be a moderate inflammation. And the third one is zones of hyperemic or zones of the inflammations. This is the least area of the damage due to the burn injury. Okay, for the normal, after the wound exposed to the burn injury, so the wound will undergo a normal healing process. So as we know that there are 4 stages of the wound healing. The first one is the bleeding stage, and followed by inflammation, proliferation, and also remodeling stage, which is, I believe you have learned about this one. But today I will highlight a little bit on the healing process of the burn wound so that we can understand the topic on the microscopic and also macroscopic examination of the burn wound. So once the skin exposed the bone to the bone injury, so immediately a hemostasis will occur. And in hemostasis, it will be followed by the vasoconstrictions. So vasoconstriction means constrictions of the blood vessels. So there will be constricted blood vessels, and at the wound areas, there will be a presence of the platelet, and there will be a platelet activation and also aggregations, and at the same time, there will be a release of the clotting and the growth factors. So what are examples of these growth factors? Like platelet-derived growth factors, PDGF, epidermal growth factors, EGF, and also transforming growth factors. And these factors are released by platelet, keratinocyte, macrophages, and also fibroblasts. So at the end of hemostasis, there will be a fibrin clot deposition at the injury site. And this fibrin clot, it will be served as a professional metric for further stages of the healing. So at the same time, so there will be an infiltration or a recruitment of monocyte, macrophages, and neutrophil to the wound area, okay, to initiate the inflammation phase. And the inflammation phase, as we know, it begins within 24 hours of the injury, and it can last for the weeks to months, depending on the severity of the injury. So what are the functions of this neutrophil and macrophage? So they release cytokine, they release chemokine, interleukin-1, interleukin-8, tumor necrosis factors. They also will release growth factors, TGF-beta, insulin-like growth factors, the VEGF factors, which is this in detail will be further explained by the Mr. Ryan. But I just mentioned a few types of cytokine and chemokine involved in case of the burn wound. And also at the same time, the neutrophil and macrophages, they will remove the debris. They will remove the pathogens that presents at the injury site. Okay, the third phases of the wound healing is a proliferation. Proliferations, it involves with the recruitment and activation of the fibroblasts and also keratinocyte. And during the proliferation process, we will see a formation of the granulation tissue. So this granulation tissue is a new connective tissue. So it replaces the wound area, and at the same time, there will be angiogenesis. So angiogenesis is formations of the new blood vessels. As we know that at the wound area, so there will be a lot of endothelial cells, there will be a lot of the fibroblasts, and these fibroblasts, endothelial cells, so they require nutrients, they require food, they require nutrients, they require oxygens, right? So the blood supply, the blood vessel will supply these nutrients and also the oxygens. So at the same time, so there will be epithelializations. Epithelializations mean formations of the new lining of the epithelium, which is the epidermis layer. Okay, so the keratinocyte will assist in the formations of the new epithelial lining and also for the formation of the angiogenesis. And together with the endothelial cells they are activated by the growth factors to initiate for the angiogenesis. And as we know that the fibroblast, it will further transform into the myofibroblast. Myo mean what? Myo mean muscle. So the fibroblasts have the contractility ability. They're able to contract, which are involved in the extracellular matrix deposition. So in the final phase of the wound healing, which is the remodeling phase, this is the maturation phase. So the granulation tissue just now, it will mature and it will further remodel under influence of the growth factors, which is the matrix metaproteinases, and there will be also a tissue inhibitors of the metalloproteinases, TIMP. So these tissue inhibitors, it will control the remodeling stage. So later on, the remodeling, it will increase the sensor strength of the newly formed tissue. Because the slides to show you the combination between hemostasis, inflammation, proliferation, and remodeling in case of the healing of the burn wound. Can I ask something? Is it so far the sound is clear or not?
Yes, Mr.
Okay, so that I can proceed with the lecture. And then we talk about the pathophysiology of the burn wound. Okay, pathophysiology is the normal one. Pathophysiology means it's abnormal. So what happens when there is a burn wound? So we know that the burn injury, it induces numerous organ dysfunctions. There are many organs will be dysfunction, not functioning, will be abnormal. Organs like a heart, kidney, liver, intestine, and etc. So the function will be disturbed. That's why it will further cause mortality to the humans or even in animal. And especially in case of burn that involve with the large surface areas, you will see a hypermetabolism and also a sepsis. Okay, the hypermetabolism, it involves with the glucose metabolism, with including insulin resistance. There will be hyperglycemia. There will be a lipid metabolism and also increased lipolysis. The mechanism is quite detailed. I'm not going to explain in detail today. You can read and you can further read on this topic. So at the same time, so this prolonged hypermetabolism, it can cause a vast catabolism, multi-organ failures, and also death. And at the same time, due to the burn injury, there will be a sepsis. There will be a septicemia, presence of the bacteria, presence of the toxins in the blood, and this sepsis, so further, it can cause further reaction in the body, which is the systemic inflammatory response syndrome, SIRS. This, I think, SIRS, we're going to be explained and elaborated by the Mr. Rian later on. And today I'm going to further share with you and on the animal model of the burn wound. As we know that in order to help and to assist the scientists, the pathologists, to understand the burn wound, so they try to develop a animal model of the burn wound by using the animals, especially rodents like rats, mice, even by using a monkey. So by using the animal model, so it will help us to understand the pathological mechanism, especially on the microscopic examination. And nowadays there are many people that test. There are many people try to find a best treatment, best therapeutic approach, best treatment in order to treat the burn wound. However, there are still limitations of the animal studies because not all animal species, the characteristic or features of the skin is similar with the human. However, animals model still can be rely and still essential to help and guide the scientists to understand the molecular and the cellular aspect of the wound. So the idea is why we do the animal model of the burn wound, because we want to mimic the burn wound that occur or happen in the human. Okay, these slides to show and to share with you on the skin histology across the mammalians. There are 6 traits like hair coat, the epidermis, dermis, the paniculoconus, the skin architecture, and wound healing mechanism. So the most species of the animals that mimic the skin of the human is a pig. Okay, but most of the studies of the burn wound are conducted by using a rodent like rat and mouse. So why people don't use pig, mostly due to the financial constraints, because we need to use many pigs in order to study for the skin, to study for the burn wound. So that's why people prefer using a rodent like a rat or mouse in order to understand the pathology of the burn wound. Okay, this is a slide to show you example of the burn wound, okay, in use in animal model of rat. Okay, this is example of the burn wound in use in animal model of pig, which is pig. It have a similar histological structure, similar skin structure if we compare to the human beings. And nowadays, there are many studies have been conducted, especially in exploring a therapeutic approach in order for us to treat the burn wound. For example, right now, people using a stem cell therapy to treat of the burn wound. So other than stem cell therapy, also people use natural products like example honey. In Malaysia, there is a tualang honey, which is in Indonesia, the tualang tree, also called as a sialang or tapang tree. Okay, there are studies that indicate that the use of the tualang honey or honey it help on the contraction, on the wound contraction effect, as the honey also have the antibiotic properties. Okay, this information I got from internet source, where in Indonesia, so people studied on the use of coconut shell liquid smoke, in which is they found that it can promote the burn wound healing. Okay, the next question is how people induce or how people create a burn wound in animals. So there are a few methods that can be done in order for us to create or induce a burn wound in an animal. The first one, we can do a direct contact with the heated animals. So where the back of this animal is shaved, we need to shave the animal first, and then the heated method is applied to the skin. Number two, people also use electric, but this one is more complex and usually been done in the large animal like monkey. And the third one, which is the most common one and the accepted one, by using the heated water model. And so heated water models is accepted as a standard for animal model of burn. Okay, the slides to show you on the experimental step in the burn rodent model in mice skin subjected to full thickness burn. So that's mean that we want to create the full thickness burn, which is the third degree of the burn wound, with the area of 30%. Total body surface area is at 30%. This is the details how they conduct, how they create, how they induce the burn rodent model. So in this case, they use the heated water. So the water is heated up to 100 degrees Celsius for period of 8 seconds. Okay, so degree of the temperature and also the time, the contact time of the water and the skin will determine the degree of the burn wound. Okay, this slide I show if I would like to share with you because there are so many scientists in the world that studied on the burn wound. So these are the informations or references. So regarding so how you want to create the model of the mouse scalp burn model. Okay, for example, if you want to create 35% of the burn injury, 35% of TBSA, total body surface area, in mouse, for example, you need to use temperature up to 80 or 97 degrees Celsius, and then the exposure time will be 50 seconds or 7 to 10 seconds. Okay, similarly to the rat, like for example, in order to create the 60% of the TBSA, so we require temperature of 96 degrees of Celsius and also exposure time, contact time of 10 seconds. Okay, now we move to the how we going to examine the burn wound, microscopic and also microscopic. Macroscopic means like we observe direct observations of the burn wound. Okay, microscopic means so we examine the burn injury by using a microscope. So we look the histological structures of the burn wound. Okay, the microscopic examination usually it involves with the evaluations of the gross wound morphology. So we can do it 20 minutes, 48 hours, 72 hours, 7 days, 14 days, and 20 days respectively. As we know, the normal wound healing process, in general, the duration took about 21 days. Okay, that's why we monitor different time interval to evaluate the gross morphology of the wound. And during the gross wound, wound morphology examination or evaluations, so we're going to analyze on the color of the wound, the consistency, and also the border, especially on the contour aspect. So during the evaluation times, the photo of the lesions can be taken for further use in comparative evaluation. Okay, the slide to show you the third degree of burn wound induced with low intensity of laser. So they create the third degree of burn wound by using a laser. You will see here, so they observe at day 3 and also day 7. So there will be a area of the hyperemia. As we know, as we learned previously, there are 3 zones: zones of the coagulations, zone of stasis, and also zones of hyperemia. And we can see here, here zones of the hyperemic, zones of the stasis, and also zones of the coagulation. Okay, at the 14 and 20 days of the healing process of the burn wounds, you can observe there will be a necrosis, there will be a fibrosis, and also there will be a granulation tissues. Okay, this is just another pictures, figures to share with all of you on the lesions at different time interval after the steam inflicted burns. Okay, this one is the skin of rat exposed to the 1 second of the 1 seconds of the steam, and this one, there's a second group on the 3 seconds of the steam exposure, and the third group is exposed to the 7 seconds of the steam exposure. So we're going to observe the wound at the first 20 minutes, and after 48 hours, after 72 hours, 7 days, 14 days, and also 21 days. And during this process, we'll see zones of the coagulation, zones of stasis, and also zones of... Okay, next one is, this is another method to create the burn wound. So they use the metal rod, and this one, the metal rod immersed in the flask of the boiling water and heated up to 100 degrees Celsius. So we might see here the burn duration of 5 seconds. It will create a secular and pale with indistinct margin of erythema. So the margin of erythema is irregular, but wounds that created with the burn durations of 10 and 20 seconds, you will see a well-defined margin, uniformly yellow-brown with a rim of the erythema, and there are no blistering observed in this wound. This is another study conducted by the Bradenberg et al. In 2019, because they want to create a burn wound that mimic the natural infections. As we know that the burn wound are exposed with the bacteria. So in this study, they create the full thickness burn wound, the type 3 burn wound, they inoculated together with the Pseudomonas aeruginosa, a bacteria of Pseudomonas aeruginosa. And we will see here the presence of a lot of the exudates and area of the necrosis. I believe that you know what is necrosis and also what are the exudates. So these exudates are coming from the inflammation. As we know, during the inflammation process, some of the fluids will be produced, will be released out from the blood vessels, and this fluid, it goes to the tissue. That's why the wound, there will be presence of the exudate at the wound area. Okay, this is another slide to show you the burn wound created on the rats. And then in this study, they use the madu, they use the honey to see the effectiveness of the honey to simulate the faster healing process in the burn wound. Okay. So basically, in overall, I would like to say that the burn wound morphology evaluations, it includes the presence of the hyperemic. Okay, we see the hyperemic. Hyperemic means reddening of the wound area. So we're going to check the blister. Is it any presence of the blister? And then check for the crusty material and look for the yellowish exudates. Look for the yellowish exudate, okay? And this, why the yellowish exudate? Because sometimes in case of when the wound is exposed to the environments, so there will be inoculation or contaminations of the bacteria. And some of these bacteria, they produce a yellowish pus. Okay, they produce a yellowish pus. So we need to check, is it any presence of the pus on the wound area? So we have to check on the crusty material, any presence of the blood at the wound area. Look on the color of the wound bag. As we know that the wound bag, during the inflammation process, there will be a more reddish in color. Reddish in color due to the inflammation of the wound bag. And during the proliferation phase, so the wound bag, usually the color is more pinkish in color because it contains a healthy tissue. And other than that, we can also check any presence of the scar. And this scar, the scarring is a part of the wound morphology examination. Okay, now we move to the microscopic findings of the burn wound. So we can check on the tissue, dermis, hypodermis, and deep tissue, and also borders of the injury. So what are the things that we're going to analyze? We look on the fibrin, necrosis. Necrosis means cell death. Hemorrhage, any presence of the hemorrhage in the histologically, any presence of the exudates, any presence of the polymorphonucleated cells and mononucleated cells. So these are polymorphonucleated cells. Usually we might see presence or infiltrations of neutrophils. Okay, we might see presence or infiltrations of neutrophils, and mononuclear infiltrations mean any presence of the mononuclear cells such as monocyte and also lymphocyte. So at the same time, dermis, we check any hemorrhage presence in the dermis, any edema, any presence of the inflammatory cells. Is it any presence of the new vascularizations, mean new blood vessels? As we know that angiogenesis is a part of the wound healing process, so we have to check any new blood vessels form. And then we look on the fibroblasts. Is it there are many fibroblasts or less fibroblasts? And then we also can monitor on the collagen. So these are the macroscopic finding, basics, macroscopic findings of the burn wound. Cool. Okay, so this is slide to show you. Okay, they have 3 pictures here. Okay, on the picture on the left, so this is the intact skin. On the intact skin, we see layers of the keratinocyte, presence of the hair follicles, presence of the fat layer, and also a muscle layer. This is a normal skin, normal intact skin, but skins that are exposed to the burn injury 48 hours, we can see a complete disruption of the skin. Yeah, complete disruption of the skin, especially on the epidermis layers and also in the dermis layer. Okay, after 2 weeks of the post-burn, 2 weeks after the burn, there will be a signs of the wound healing. Okay, signs of the wound healing. That's why we start to see a new epithelial linings. We will start to see a new blood vessels formations, and also formations of a new granulation tissues. Okay, that's why, as I said just now in the beginning, very, very important for us to know a basic histology of the skin so that we can appreciate how to observe, how to see the basics of the wound. Okay, this slide is to show you this is the second degree of the burn wound. Okay, after day one of a burn, post burning, there is an area of the necrosis area. So this is a necrosis areas, and we will see this needle to show you infiltrations of the inflammatory cells. Infiltrations of inflammatory cell, especially on the neutrophils. Okay, this slide to show you again a second degree of the burn wound. We will see there are skin necrosis and at the same time infiltration with the inflammatory cells. Okay, in case of the burn wound, we might see presence of the scab, a heat scab, and also there will be a lot of the presence of the inflammatory cell, especially the neutrophil. So we move to the next topic, how we're going to prepare a slide for the H&E staining and also immunohisto staining. I'm not going to describe in detail, we don't have much time. So basically, it involves with the tissue processing. So this tissue processing means a step required to take animal of the human tissue, which is the wound tissue or skin tissue, from the fixation stage, where this one, the tissue will be infiltrated with the histological web, and it can be embedded ready for the section cutting by using the microtome. Okay, so what are the steps of tissue processing? The first one, we have to collect the fresh samples, either human sample, human wound, or human wounds, or even an animal wound. We must take a fresh sample, and these samples must be fixed by using a fixative such as formaldehyde. We can use a formaldehyde. So minimum, the tissue must be soaked or immersed with formaldehyde for 24 hours. And after 24 hours, it can be further processed. There will be a dehydration and cleaning. So they will use ethanol and also xylene, where we will use automatic processes in order to process the tissue. So after the dehydration and cleaning, so there will be a stage of embedding. So we will use a wax, a paraffin wax, for the embedding. So to make a block of wax that contain a tissue, and after that, the wax blocks, there will be a trimming and also sectioning, and then followed by staining. So what is H&E, hematoxylin and EOC staining? Which is, I believe you know that this is the basic staining for the histology laboratory. And there are two stains here, hematoxylin and eosin. The first one, the hematoxylin, is used to illustrate the nuclear detail in cell. So that means by using the hematoxylin, we're going to observe, we're going to see the nucleus detail of the cells. And eosin, so most commonly used counter stain that distinguish between cytoplasm and nuclear cell. So again, hematoxylin is stained for the nucleus, and eosin, it will stain for the cytoplasm. Okay, this slide is to show you comparative between the colors between the nucleus and also the cytoplasm. So hematoxylin again is stained the nucleus into purplish in color, and eosin is stained the cytoplasm. That's why you see a pink color. And this one, the staining procedures for hematoxylin, So it follows a basic protocol. It starts with de-waxing. So how we going to remove the wax? We use xylene. And for dehydration, so we're going to use a different concentration of the ethanol, and then followed by the hematoxylin, differentiation, and also bluing by using a mild acid such as the acetic acid, and then followed by eosin, dehydration, clearing, and cover slipping. I believe that the students of the medical laboratory technologies learn about these procedures. This is the basic H&E procedures that applied for the histology and also pathology laboratory. Okay, now I'm going to talk about the immunohistochemistry. So immunohistochemistry is a combination between the immunology, histology, immunology, histo means tissue, and also chemistry. So immunohistochemistry, also known as IHC, is used in histology to detect the presence of a specific protein marker. So other than hematoxylin and special stain like Mason trichome stain, so people use immunohistochemistry for us to detect specific protein markers. And so how the what are the components of the immunohistochemistry? The first one is a target antigens. So we must know what are the antigens that we target, that we want to identify, that we want to find, investigate. So these antigens are basically proteins that are within or on the surface of the cells. And then the second one is a primary antibody. And the primary antibody were applications of the primary antibody that bind specifically to the target antigen. And there are two types of the primary antibody, either polyclonal antibodies dan juga and monoclonal antibodies. For polyclonal antibodies means this it has affinity with and bind to multiple epitopes of the target antigen. As we know that the antigen, the protein, it has many epitopes, 5. So these polyclonal antibodies, it will bind to all these epitopes. And second one is the monoclonal antibody, which is only have they have affinity only to one epitope. And the second one is a secondary antibody. So the secondary antibody, it will bind to the primary antibody. So this is we call it as indirect immunohistochemistry. So in general, immunohistochemistry have two types, direct and indirect one. For direct IHC, it only involved with one antibody, the primary antibody. But for the indirect antibody, indirect immunohistochemistry, it have two, the primary antibody and the secondary antibody. So later on, you can read what are the advantages and also disadvantages between the direct IHC and also the indirect IHC. So, but people prefer the indirect IHC. So this secondary antibody, it used as a multiple secondary, so it can bind the single primary to amplify the staining intensity. So the secondary antibody also influence on the staining intensity for the IHC. And the third one is the detection system. So the detection system, it will build on the secondary. So we're going to use a chromogen detection, which is we utilize enzymes such as the peroxidase enzyme, the horseradish peroxidase enzyme, the alkaline phosphatase enzyme. So this enzyme, they will conjugated or they will join together with the antibody. So the next one is a chromogen. So this chromogen, as we know, just now mentioned about enzyme. So there will be a substrate form, the chromogen. So the chromogens, it will form insoluble color precipitate. So this color, especially a brownish color, so it will precipitate. That's why we can further visualize this under microscope. So there are two commonly used of chromogen. The first one, DAB. DAB will give a brown color, and also AP. AP will give a red color. Okay, and most of the condition, most of the applications, people use DAB as it can provide a strong and permanent stain. And the second one, AB rate, usually mainly for the skin section. And then some people also, some scientists also, they also prefer both DAB and also AP rate chromogen. So a completed IFC stain where the brown precipitate indicates the presence of the target antigen. As you see here, I include also the pictures of the IFC, very high intensity of the brownish, so it indicates high presence of the target antigen. So the amount of staining, the staining pattern, and the location of the staining, we can check either the staining more to the cytoplasm or more to the nucleus. And for the blue background, so we can counter stain with the hematoxylin. So for the protein marker of the burn wound, so there are many protein markers that people are looking, including the growth factors, including the apoptotic and anti-apoptotic protein, BCL2 proteins, BAX protein, the hypoxia inducible factors. So any proteins that involve of the wound healings, so you can it can be a protein marker of the burn wound. So it depends on your target. What are your research target? So now we move to the last stage of the presentation today. How are you going to interpret results of the burn wound examinations? The first one, we can look based on the H&E stain tissue, based on hematoxylin eosin stain tissue, where you can look on the wound healing parameters. Okay, that's why very important for us to understand in detail the healing process, which is the start with the hemostasis, the inflammation, the proliferation, and also the remodeling, which involve the collagenation, so that when we do examine the wound tissue, we're able to do a detailed interpretation. So the wound healing parameters can be classified into based on the inflammatory cells, based on the fibroplasia, collagenation, angiogenesis, and also epithelialization and granulation tissue formation. So we can do a scoring of these parameters. We can classify either to mild, moderate, or any and severe lesion. Okay, the slide to show you. So other studies have been conducted to look on the burn wound. So they look on the parameters of the inflammatory cells such as neutrophil, lymphocyte, and they look at the presence of the fibroblasts, any formations of new blood vessels, angiogenesis, and also for the granulation tissue. Okay, for the burn wound, so there are some studies also, they look on the necrosis depth. Necrosis depth, they score either +1 or +2 or +3. So if a +1, like they only involve epidermis and superficial papillary dermis. A +2, it involves the epidermis, superficial papillary dermis, and also upper level of deep reticular dermis. And +3, so it involves epidermis, superficial papillary dermis, and deep reticular dermis. And also they do scoring on the collagenation, any presence of the collagen or not. Inflammatory infiltrates mean they look on any presence of the inflammatory cells, and for the vascular lesions means they look any new formations of the blood vessels. This is another study to share with you how they look on the scoring of the burn wound based of edema, congestion, necrosis, infiltrations of inflammatory cell, proliferations of the fibroblasts, angiogenesis, and also epithelialization. So one thing to take note and understood that towards end and complete of the healing process, there will be a decreased numbers of the inflammatory cells. When apabila wound semakin sembuh, so kita akan lihat there will be a decreased numbers of inflammatory cell. There will be a thick, compact, and well-arranged collagen fibers. So there will be a complete epithelializations. there will be decreased numbers of the blood vessel, fibroblasts, and also decreased granulation tissue. Because of what? Because the wounds now are going towards the complete healing. So that's why it's interpretation of the IHC result. As I mentioned previously, the brownish staining of the tissue is indicate presence of the antigen. So the higher brownish expressions indicate the higher presence of the target protein. And then nowadays people use imaging software in order to help them to do a counting of the stem cell. So we can count how many of the cells that give the brownish stains. So that we know how much protein, how much growth factors produced or expressed in the wound area. So other than that, people also look at the intensity of the staining. So the brown color, so we can further determine intensity. It can be done by manually, or nowadays people use an automated camera or computer or software to look on the intensity of the staining. So the slides to show you the immunohistochemical detection of the TGF-beta1. So as we know that the transforming growth factors beta-1 is involved in the proliferation and also remodeling. So we want to know, is it the expression is higher or less? Okay, this is another slide to show you the applications of the immunohistochemistry. We can see that there's a high expressions, a brownish expression in the group, in the pictures C and E compared to the control group. Okay. And this one is another slide to show immunohistochemical staining of the VEGF and also the epithelial growth factors EGF. A higher expression, higher brownish expressions mean higher presence of the target protein or target antigen. So these are the references for my lecture for today. You can look further, you can read further. And I would like to say, I think I come to the end of the sharing session today. I would like to say again, thank you to organizer, thank you to the chairman of the STIKES, Dr. Soebandi. I wish I can visit STIKES Dr. Soebandi in Jember, in the East Java one day, inshallah. Okay. So I think that's all for today from me. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Dr. Muhammad Farhan Hanif bin Redwan, Doctor of Veterinary Medicine, Philosophy of Doctor, for giving us such informative and interesting presentation. Okay, all participants, ladies and gentlemen, our second speaker today is Mr. Rian Anggia Destiawan, Bachelor of Veterinary Medicine, Master of Immunology. I will read the CV. This is a CV from Mr. Rian Anggia Destiawan. Mr. Rian Anggia Destiawan, Bachelor of Veterinary Medicine, Master of Immunology. Birth in Situbondo, December 20, 1994. Phone number +6281332027951. Email riananggia12@gmail.com. He is one of the lecturers in Medical Laboratory Technologies to the program of STIKES Dr. Soebandi. He has received his bachelor degree in veterinary medicine at Universitas Brawijaya and taken his master degree in immunology at Universitas Airlangga. Experience is lecturer assistant of immunology in veterinary faculty Universitas Brawijaya. International Conference, Malaysian Association of Veterinary Pathology, Kelantan, Malaysia, on 20. The third International Conference, Postgraduate School, Universitas Airlangga, Indonesia, on 2019. Now allow me to welcome the second speaker, Mr. Rian Anggia Destiawan, Bachelor of Veterinary Medicine, Master of Immunology, to deliver his presentation. Mr. Rian Anggia Destiawan, Bachelor of Veterinary Medicine, Master of Immunology, the time is yours.
Okay, thank you, Mr. Anas. I'm sorry. Okay, thank you, Mr. Anas, and thank you, Dr. Farhan, for presenting about pathology burn 1. And Assalamualaikum warahmatullahi wabarakatuh. Now I will presentation about immunology of burn 1. Before I explain about immune response of burn 1, I will explain basic immunology, such as what is immunology, what is immune system, and component immune system, and others. Okay, what is immunity? Immunity is protection against disease, especially to infectious disease. For example, microorganism, bacteria, virus, and parasite, and fungal. And then what is immune system? Immune system is cells and molecules that are responsible or play a role in immunity. Cell, for example, is the cell any eosinophil, and then neutrophil, basophil, and mast cells, and then molecule, for example, alpha catalycidin and beta catalycidin and others. And then what is immune response? Immune response are cells that are coordinated to respond and to recognize foreign substance. For example, interaction with dendritic cell in the lymph node with T cells. And then the last, antigens. Antigens are foreign substance that can induce an immune response. Antigens separated to type. Number one, PAMs, or pathogen-associated molecular patterns, and the second is DAMs. DAMs is damage-associated molecular pattern. Okay, immune response separated to type. The first, innate immunity, and the second, adaptive immunity. What is the innate immunity? Innate immunity is defense against foreign microbe. For example, virus, bacteria, parasite, and fungal, and tissue damage in the first few hours or days after infection, before adaptive immune response develop. And then what is adaptive immunity? Adaptive immunity is response after innate immunity or first difference developed. It is stronger and more specific to antigen infection. It is capable of eradicating infection. And then component innate immunity separated to types. The first, physical and chemical barrier, such as epithelial and antimicrobial. And then the second, blood protein, such as complement and mediator inflammation. This is a cellular component of innate immunity. We know immunity is split to types, innate immunity and adaptive immunity. Innate immunity and adaptive immunity derive from pluripotent hematopoietic stem cell in bone marrow. Pluripotent hematopoietic stem cell in bone marrow induced by cytokine in the microenvironment, and then pluripotent hematopoietic stem cell differentiated to common lymphoid progenitor and common myeloid progenitor. Common myeloid progenitor differentiated into granulocyte or macrophage progenitor and megakaryocyte or erythrocyte progenitor. Megakaryocyte or erythrocyte progenitor differentiated to megakaryocyte and erythroblast. And then if erythroblast migration in the blood circulation, erythroblast differentiated to erythrocyte. And then megakaryocyte, if in the circulation of blood vessel, megakaryocyte differentiated to platelet. And then granulocyte or macrophage progenitor will be differentiated into several cells. And then in the picture, any granulocyte or polymorphonuclear leukocyte such as neutrophil, eosinophil, and basophil. And then unknown precursor of cell mass and monocytes. If monocytes migration to tissue, monocyte change to macrophage. And then unknown precursor of mast cell, if migration to tissue, unknown precursor of mast cell change to mast cells. And then how about a common lymphoid progenitor? Common lymphoid progenitor will be differentiated to B cell, T cell, NK cell, innate lymphoid cell, and immature dendritic cells. In the lymphoid, B cell and T cell will interact with dendritic cell that bring antigen or cytokine from tissue damage, and then occur interaction with dendritic cell and T cell. And then B cell and T cell occur effector cells. B cells will be differentiated to plasma cell and memory cell. And then T cell differentiated to activated T cell, such as C cytotoxic cell, C cytotoxic lymphoid, or T helper cells. Okay, cellular immunity. Cellular immunity, such as phagocytic cell, such as macrophage and neutrophil. What is the function macrophage? Function of macrophage: the first, ingest and kill invading microorganism and phagocytic of tissue damage, and the second, produce many inflammatory mediators that activate other immune system cells and recruit them into the site of infection or trauma. And the second, neutrophil. What is the function of neutrophil? Function of neutrophil, the first is first responder at the site of infection of trauma, and the second, clearance debris or necrotic cell caused by injury. The second is dendritic cells. What is the function of dendritic cells? Function of dendritic cell is presenting cell, and the second, activating a particular class of lymphocyte T of the adaptive immune system. And the third, mast cells. Function of mast cell is protection the internal surface from pathogen, including parasite worms. And function the second is response to allergy. Okay, and then basophil and eosinophil. Function of basophil and eosinophil. First, immensely important in defense against parasites. The second, contribute to allergic inflammatory reaction, in which their effects are damaging rather than protective. And the last, natural killer cell. Function of natural killer cell is kill tumor cell and virus infected cells. How about adaptive immunity? Adaptive immunity is a response after innate immunity or first defense developed, which is stronger and more specific antigen infection in the body, which is capable of eradicating event-based infection. Adaptive immunity is separated to type, the first cellular and the second, cellular, separated to type, and B cell and T cell. B cell effector will be differentiated to plasma cell and memory cell. Plasma cell will produce antibody, and then T cells separated to type, the first cytotoxic T lymphocytes, and then cell T helper. The second is humoral, such as antibody. Antibody, very important when infection virus in the body. Okay, now burn wound. Burn wound cause skin damage we call necrosis. Necrosis is an uncontrolled process and the dying cells release their contents. Now we look the picture in the left side. The first, it is cell normals. Cell normal if receive trauma, for example, burn wound, and then cell normal cause cells and organelle swell, and the second, chromatin condenses, and the third, membrane compromise, for example, fluid resus in, and then all of this cause dissolution of cellular structure. Dissolution of cellular structure will cause cell disease, and the second, invasion of phagocytic cell, and the third, inflammation. Inflammation such as cytokine pro-inflammatory cytokine, for example, TNF alpha, interleukin 1, interleukin 6, and interleukin H. This is right side. This is my research about burn wound. This is a positive control in burn wound. In the picture occur tissue damage from epidermis to dermis, and then occur cellular destruction in the layer screen, especially epidermis and dermis. Okay, necrosis in the tissue injury will produce number one, SP, and then monosodium urate, the group box protein 1, extracellular ATP, and then nucleic acid including mitochondria DNA, and the last, interleukin 1 alpha and interleukin 33. And then necrosis cause extracellular membrane destruction. Extracellular membrane destruction such as hyaluronic acid, collagen damage, elastin damage, all of this we call DAMs, or damage associated molecular pattern. Okay. Tissue repair has 4 steps. Step 1 is hemostasis. Hemostasis occur platelet recruitment, and then neutrophil swimming, and then phagocytosis and pathogen clearance. The third, resolution and proliferation. In the resolution and proliferation occur anti-inflammatory macrophage and cell proliferation and extracellular membrane deposition. And the last, remodeling occur macrophage interleukin 4, and then extracellular membrane remodeling, and the last, wound contraction. Okay, number 1, homeostasis. Homeostasis occur platelet in homeostasis occur platelet recruitment. What is the function platelet recruitment? Function of platelet recruitment is a limit blood loss during tissue injury, and the second, modulate other aspect of tissue repair, including cellular migration, extracellular matrix or ACM remodeling, and cell proliferation and differentiation, as well as the process of angiogenesis or neovascularization. The second step is inflammation. Inflammation occur because DAMs activated macrophage in the tissue damage. Activated macrophage will phagocyte mechanism ingest tissue injury. Phagocytosis mechanism ingest tissue injury will produce pro-inflammatory cytokine. For example, TNF-alpha, interleukin 1 beta, interleukin 6, and interleukin 8. Pro-inflammatory cytokine will attract neutrophil from blood vessel to injury. What is the function neutrophil in the tissue injury? Function neutrophil is tissue injury is phagocyte mechanism ingest tissue injury. Function same with activated macrophage in tissue injury. Okay, this is migration neutrophil from blood vessel to tissue damage. I'm sorry. In the tissue damage will produce HMGB1 and others components we call DAMs. DAMs will be recognized by macrophage in the tissue damage, and then macrophage in the tissue damage will phagocyte to tissue damage, and macrophage release cytokine and chemokine. Cytokine that are released from macrophage is TNF-alpha and interleukin 1. Cytokine TNF-alpha and interleukin 1 that activate the endothelial cells of nearby venule to produce selectin, and then ligand for integrin and chemokine. This is selectin, and then this is this is integrin and other component. And then if selectin in the endothelial cell will attract a neutrophil for interaction with selectin ligand. neutrophil will interaction with selectin in the endothelial cells, and then chemokine receptor will interaction with chemokine in the proteoglycan, and then integrin high affinity states will interaction with integrin in endothelial ligand, and then if integrin interaction and then chemokine receptor interaction with chemokine, so neutrophil will migrate from the blood vessel to tissue injury, and then function neutrophil in the tissue injury is neutrophil will release ROS or reactive oxygen species. ROS effect ROS in the tissue is DNA damage and lipid peroxidation, and then neutrophil in the tissue damage will release cytokine pro-inflammation. Effect cytokine pro-inflammation will cause inflammation in the tissue injury. And then neutrophil have a mechanism is netosis. Effect netosis in the tissue injury is tissue damage and matrix digestion. And then the last function neutrophil is degranulation. Degranulation in the tissue injury cause tissue damage in the tissue injury. All of these cause pathogen killing, but side effect in the pathogen killing will cause inflammation, increased inflammation, and increased injury in the tissue damage. Okay, this is my research about burn wounds. In the left side, this is no expression because negative control, and then in the right side, this is expression TNF alpha because this is positive control. Mice, we make one model, and then we look in the EHC staining in the picture. This is expression TNF alpha from macrophage, yellow row, and then expression TNF alpha from macrophage, and then expression TNF alpha from macrophage. If inflammation increase in the body, cause SIRS or systemic inflammatory response syndrome. If human or mice or animals have a SIRS or systemic inflammation response syndrome, and then at infection, for example, bacteria or parasite or virus, this is a cause sepsis. What is the sepsis? Sepsis is the body extreme response to an infection. Without timely treatment, sepsis can rapidly lead to tissue damage, organ failure, and death. This is sepsis. Sepsis occur when chemical released into the bloodstream to fight an infection. For example, bacteria, and then parasite and virus. Inflammation response to infection in the bloodstream trigger inflammation response throughout the body. Inflammation response throughout the body can damage vital organ, for example, lungs and heart, liver, and kidney. The second is proliferation. Dams, especially interleukin 33, will produce from tissue damage, and then interleukin 33 interact with ST2. ST2 is a receptor in the dendritic cells, and then interleukin 33 interaction with ST2 in the dendritic cell. And then dendritic cells migrate to lymph nodes. In the lymph nodes, dendritic cell will presentation about interleukin 33 in the T helper, and then T helper proliferation, and then T helper polarization to T helper 2 cells, and then T helper 2 cell activate in the lymph node and migration to tissue injury. What is the function T helper 2 cell in the tissue injury? Function of T helper 2 cell in the tissue injury is polarization from M1 to M2 or alternative macrophage in the tissue damage. This is illustration for interaction dendritic cell with T cell naive. Epithel tissue damage produce especially interleukin 33, and then interleukin 33 recognized by dendritic cells. Dendritic cell will migration to lymph node, and then in the lymph node, dendritic cell presentation interleukin 33 to T cell naive or naive T cell, and then naive T cells will produce interleukin 4. Interleukin 4 that produce polarization naive T cell to T helper 2 cell, and then T helper 2 cell in the tissue will produce cytokine, interleukin 4, interleukin 5, and interleukin 13. This is process migration in the from the lymph node to tissue injury. T cell, activated T cell or effector T cells, especially T helper 2 cells, will will migration from the lymph node to peripheral tissue through blood vessel, and then in the peripheral tissue, migration from blood vessel to endothelial or to tissue damage mediated by selectin ligand, and then integrin and chemokine. Okay, what is the function T helper 2 cell in the tissue damage? Okay, T helper 2 cell in the tissue damage will produce interleukin 4 and interleukin 13, and the function of interleukin 4 is blocking T helper 1. We know that T helper 1 is cells that produce pro-inflammatory cytokine and then increase macrophage M1s. And then interleukin 33 induce macrophage for change from M2 to interleukin 33 induce macrophage for change from M1 to M2. M1 as release pro-inflammatory cytokine, and M2 release anti-inflammatory cytokine. Okay, alternative macrophage or M2 will release interleukin 10 and TGF beta. In the interleukin 10 and TGF beta as anti-inflammatory effect. Anti-inflammatory effect. This anti-inflammatory effect will suppress inflammation from M1. For example, cytokine, interleukin 1, interleukin 12, and interleukin 23. Okay, TGF. What is the function of TGF? TGF function is endothelial cellular matrix deposition, and the second is fibroblast proliferation, and the third myofibroblast differentiation. All this is cause tissue repair in the tissue damage. This is a picture in the left side. This is a control negative, no expression TGF beta, and then the right side. This is a positive control from the burn wound. We look expression TGF beta in the tissue damage. And then macrophage release TGF beta, and then macrophage release TGF beta. Okay, the second other macrophage in the tissue repair any neutrophil. Neutrophil, the first response is pro-inflammatory cytokine, and then after inflammatory cytokine, neutrophil induced by TGF beta. When neutrophil induced TGF beta, neutrophil 1 switching to N2. And then release VEGF or vesicular endothelial growth factor and arginase, MMPH, and MMP9. VEGF stimulated wound healing via collagen deposition, angiogenesis, and epithelialization. And then arginase. And then arginase metabolize L-arginase to produce L-ornithine and urea. L-ornithine is the substrate for the ornithine decarboxylase or ODC for the production of differentiation polyaminase through sequential reaction. Polyaminase are very important for the cell proliferation, and then ion channel function, and the last neuronal function, and others. L-ornithine is also a substrate for another enzyme called ornithine aminotransferase or OAT, and is utilized for the production of prolines. What is a critical component collagen formation in L-prolines? Okay, next, and then MMPH. Function of MMPH is cleave fibrillar collagen. In the normal acute wounds, expression level of MMPH is low. MMPH expression and high level of active MMPH are associated with chronic disease. And the last, MMP9. MMP9 cleave collagen 4. We know function of collagen 4 is a primary component and basement membrane. MMPH and MMP9 stored in neutrophil granules. Okay, and the last, remodeling. Remodeling phase is the fourth phase of healing wherein the maturation of graft or scar take place. In this final phase of wound healing, initially there is laying down of fibrous structural protein. For example, collagen and elastin around epithelial, endothelial, and smooth muscle as extracellular matrix. This is a mechanism from tissue repair. Number one, coagulation and tissue formation and remodeling. Now I will focus explain about remodeling. Remodeling occur collagen and skin appearance. In the collagen, if small, and parallel bundles, and then we cause flat and discolored. This is normal scars. And the second, thin fibers in the collagen, and the second, increased synthesis and crosslinks cause scar rise. That is hypertrophic scars. And the third, thick fibers, increased synthesis and crosslinks cause scar release spread beyond wound boundaries. Now, this is keloid scars. Why fibrosis formed? Fibrosis is characterized by increased deposition of extracellular matrix or ICM protein in the interstitial, leading to stiffness and loose organ architecture and function. Fibrosis affect almost all organ system and account for 45% of disease-related death. Fibrosis occur when increasing of TGF-beta that are released from macrophage and neutrophil, especially N2. Increasing TGF-beta cause upregulated and activated in fibrotic disease and modulate fibroblast phenotype and function. Induction by fibroblast transdifferentiation while promoting matrix preservation. Now, this is the picture process of fibrosis healing. Fibrosis formed from chronic injury and inflammation, lungers, and or necrosis. And then all of this cause persistent myofibroblast activation in the tissue injury, cause imbalance between MMP and TIMP. Imbalance MMP and TIMP cause excessive extracellular matrix deposition, and then cause fibrotic healing that roll collagen and fibronectin in the tissue injury. This is a chart different normal wound healing, ulcer, and fibrosis. In the normal wound healing, inflammation and new tissue formation and remodeling is the same, and then increasing inflammation, but new tissue formation and remodeling decrease. Between ulcer and normal wound healings, in the fibrosis occur remodeling increase, but inflammation and new tissue formation is decreased. Okay, thank you. That's all my presentation today. Thank you for your attention. Please continue, Mr. Moderator.
Thank you very much, Mr. Rian Angedesiawan, Bachelor of Veterinary Medicine, Master of Immunology, for giving us such informative and interesting presentation. Okay, ladies and gentlemen, I will invite all of our speakers today, Mr. Farhan and Mr. Rian. Are you hear me?
Yeah.
Hello, Mr. Rian and Mr. Farhan.
Okay.
Hello.
Yes.
Yeah.
Okay. Now we come to the question and answer session. Well, ladies and gentlemen, I have already had many questions, but I choose 3 questions for Mr. Rian and Mr. Farhan. Okay, we start from first speaker, Mr. Farhan. The first one is coming from Miss Ananda. She asks about how this disease affects toddlers is the way of healing the same as adults. Okay, it's clear, Mr. Farhan?
Yes, clear. So the first question is how this disease affect toddler. Okay, toddler means a very young child. As we know, burn injury also can occur to the toddler, to the baby, especially due to the usually relate with the scald. Okay, scald, 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 due to the, for example, hot water. And based on the studies survey conducted on the burn injury in toddler, in children, so they find out that more than 70% cases of the burn injury in toddler related with the scalp burn injury. So usually due to the hot water. As we know that babies, so we give them milk. So sometimes the susu, the milk too, the temperature is high. So it basically the healing process is quite similar between the toddler, the children, and the adult. But as we know that matured healing participant.
Okay, Mrs. Ananda, are you satisfied? Mrs. Ananda? Okay, I think it's so clear. We go to the next question for Mr. Farhan. It's coming from Miss Handini. Asks about what is the goal stand for this examination?
Okay.
It's clear,
Okay.
Mr. Farhan.
For the history. So the question is, this is for the histological examinations of the burn wounds. So we can use
Your sound so slow. Please repeat.
Is it better?
Yes. Yes, better than before, Mr. Farhan.
Examination, examination, we we can use the hematoxylin and also eosinophils therein, but sustain goal stain for the burn wound. For the
Okay, Miss Handini, it's clear. Are you satisfied or no? Okay, I think it's
so that is
clear to
my
Mr. Farhan.
answer. For the second question.
Okay, we go to the next question. It's from Safarin. First, how you determine the timeline of 3 zones to be developed for each type of burn wound? I was thinking this information might help us in the crime scene to further investigate case. The second question, how to distinguish the 3 zones between different types of burn wound, especially the 4th degree of burn wound. The last, in your study, on what basis you had determined the 8 seconds of time when you immerse the mice in 100 Celsius water? In histopathology, is there any difference to process tissues from 4th degree of burn wound due to flame compared to normal routine tissue process? Thank you.
How do you assess measure the timeline of seasons need to be developed or for every each type of time burn wounds. So I want section and in my as I said, is zone of chemical. if anyone have idea just rely on actions of I said number 3 in your study you have as 3 zones you have the time has on studies that and then after they immerse as post the preparation, the basis is based on the research that has been done on the mice. And then the fourth question in histopathology, is there any different to process tissue from a 4th degree of burn wound due to the flame compared to the normal routine process? And this one, as we know, the 4th degree of burn wounds, so it involves many layers of the skin, the epidermis, the dermis, the subcutaneous tissue, and also the muscle or the bone. And as the flame bone burn, so the samples, the tissue usually become very fragile, and the burn wound look very dark. So we need to be very careful to handle the wound tissue. And then as it become very fragile, so easily can be ruptured. So that in order for us to maintain the structure of the tissue, especially during the processing time. So what I done is I will cover the tissue from the 4th degree of burn wound. We can cover by using like a tissue, so that we avoid from the tissue to be ruptured or to become to be ruptured. Yeah. So that during the processing time, the tissue will be maintained. So otherwise it will be ruptured. I think that's all for my opinion for this question. So if anyone have further other points, you can share with us today. What do you think, Dr. Shafarin? Do you have any comments on the statements that I just mentioned just now?
Okay, thanks, Mr. Farhan. Are you satisfied, Ms. Safarin? Ms. Safarin?
Yes, thank you very much for the explanation. Yeah.
Okay, thank you. Okay, we go to the next speaker, Mr. Rian. Mr. Rian?
Yes.
Okay. The first question is from Fadi. Ask about which cell play the most role in bone wounds.
I'm sorry. Repeat your question.
Okay. Which cell play the most role in bone wounds? It's clear?
Yeah. It's the most immune system in the burn wound is first response, and then macrophage and neutrophil. And then if the longer inflammation, if other immune cells is cell mass, and then T cell and B cell. But in first response in the tissue injury, very important is macrophage and neutrophil. And then macrophage and neutrophil, first response is pro-inflammatory cytokine, and the other response is release in anti-inflammatory cytokine, for example TGF beta. Function of TGF beta in the tissue repair is activated fibroblasts and activate myofibroblasts is the role tissue repair.
It's enough.
Okay.
Okay, we go to the next question. It's from Miss Nikki. Assalamualaikum warahmatullahi wabarakatuh. I want to ask, how does a medical laboratory technologist take a blood sample of patient with 80% burns?
Okay, thank you. Before I'm sorry, I will explain about with bahasa. Oke. Untuk cara pengambilan darah pada orang yang mengalami luka bakar 80%, kita tidak boleh mengambilnya di area luka bakar tersebut seperti itu, karena memang nantinya takut terjadi infeksi dari mikroorganisme luar. Namun kita bisa mengambilnya darah tersebut melalui daerah yang tidak mengalami luka bakar seperti itu. Jadi tingkat infeksi ketika kita mengambil darah yang pada orang yang mengalami luka bakar itu dapat diminimalisir. Yang
Okay, I will translate answer from Mr. Riyad. So, we don't permit to take a blood sample in area of burn wound. So, we must choose a normal area, because if we do take a blood sample in a burn wound area, it can make infection. Okay, are you satisfied, Miss Nikki? Hello, Miss Nikki. Okay, I think it's so clear. So we go to the next question. It's from Mr. Safarin. Is asked about, does immune response to burn wound similar of each other in different causes of burn wound? And the second, what is the difference of immune response to burn wound in different type or degree of burn wound? Thank you.
Thank you. Yeah. Okay. Thank you, Dr. Safarin, for your question. Now I will I will try answer your question, and then does immune response to burn wound similar of each other in different cause of burn wound? In the all tissue injury, first response is homeostasis, and the second is homeostasis. And then homeostasis is that rule by macrophage and neutrophil is the first defense if any tissue injury in the body. And then the third is proliferation and the remodeling. Jadi ini respond to burn one is the same with from 1 degree to 4 degree. And then what is the difference of immune response to burn one in different type and degree of burn one? My suggest is same with burn one from 1 degree to 4 degree. And then that different in here is cytokine that are released from the cell immunes, especially macrophage and neutrophil. And in the third burn one or full thickness may be very longer maybe release cytokine by macrophage and neutrophil very longer if in the full thickness burn one. And then between in the 1 degree superficial thickness, maybe cytokine released by macrophage and neutrophil is very short. And between 1 degree, 2 degree, 3rd degree, and 4th degree, different is fibrosis. Maybe full thickness is maybe in full thickness kejadian fibrosis itu sangat tinggi seperti itu. Nah, berbeda dengan different with 1 degree, mungkin maybe kejadian fibrosis itu sangat rendah. Oke, thank you, Dr. Safarin. I will back to moderator.
Okay, Mr. Safarin, are you satisfied?
Okay, yes. Thank you.
Okay, thank you. Okay, thanks, Mr. Farhan and Rian. Regards of respect, I will symbolically hand over certificates to the speaker. First for Mr. Dr. Farhan. Please give applause. Okay, the second is for Mr. Rian Anggiadesiawan. Okay, ladies and gentlemen, we finally come to the end of our this session. Before I go back to the Master of Ceremony, I would like to take a conclusion from what the speaker has presented. Burn injuries are an underappreciated trauma that can affect anyone, anytime, and anywhere. The injuries can be caused by vision, cold, heat, radiation, chemical, or electric salts. Burn injuries, particularly severe burn, are accompanied by immune and inflammatory response. The immune system that plays the most role in burns wound is the innate and adaptive immune system, especially macrophage, neutrophil, and T helper cells. Okay, I'd like to thank the speaker, Mr. Farhan and Mr. Rian, for the informative and interesting presentation, and all the participants for the very active participants. Finally, give the applause for the speaker and for you all. Thank you. Assalamualaikum warahmatullahi wabarakatuh. Okay, Miss Dini, time is yours.
Thank you for Mr. Anas. Ladies and gentlemen, we finally come to the end part of this webinar. Before I close the webinar, I'd like to thank you so much to the speaker for informative and interesting presentation, and participants for very active participation. Hopefully, the seminar will be beneficial for everybody. Amin. To all webinar participants, please fill in the attendance link listed in the Zoom chat column. I am Dini Atira as the Master of Ceremony. Beg your pardon mistaken we have made. Thank you and see you for the next webinar. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Pilihan terbaik bagi lulusan SMA yang ingin mendalami Dr. Soebandi Jember, kampus unggul kooperatif wilayah 7 Jawa Timur terbukti lulusannya mampu bersaing di tingkat nasional. Dr. Soebandi Jember memiliki program studi S1 Kebidanan, Profesi Kebidanan, D3 Kebidanan, S1 Keperawatan, Profesi Keperawatan atau Nurse, S1 Farmasi, dan program studi D4 Analis. Dibimbing pengajar profesional, didukung program unggulan berbasis keperawatan dan medikal bidang, farmasi herbal, training by expert, kewirausahaan, juga penguasaan bahasa Arab dan bahasa Inggris. Menempati kampus megah dan representatif, fasilitas belajar lengkap, tersedia beasiswa, serta biaya. Info lanjut hubungi 48356 atau langsung ke Jalan Dr. Soebandi nomor 99 Jember. STIKES Dr. Soebandi Jember, langkah pasti menuju profesi apoteker, perawat, dan bidan. Pilihan terbaik terbaik bagi lulusan SMA yang ingin mendalami ilmu kesehatan. STIKES Dr. Soebandi Jember, kampus unggul kompetensi wilayah Jawa Timur, terbukti lulusan yang mampu bersaing di tingkat nasional. STIKES Dr. Soebandi Jember memiliki program studi S1 Kebidanan, Profesi Kebidanan, D3 Kebidanan, S1 Keperawatan, Profesi Keperawatan atau nurse, S1 Farmasi, dan program dibimbing pengajar profesional, didukung program unggulan berbasis keperawatan dan medical care, farmasi herbal, training by expert, kewirausahaan, juga penguasaan bahasa Arab dan bahasa Inggris, menempati kampus kuliah dan representatif, fasilitas belajar lengkap, tersedia beasiswa, serta biaya pendidikan yang terjangkau dan dapat diakses. Info lagi hubungi 483536 atau langsung ke Jalan Dr. Soebandi nomor 99 Jember. STIKES Dr. Soebandi Jember.
Sudah